Psychiatry Department, who is incidentally the resource person of this evening's topic. The team of doctors, interns, and students from NIMHANS who are responsible for starting and providing all support for these webinars, the enthusiastic and inquisitive viewers from across the country. I have pleasure in welcoming you to this important webinar on this New Year Day. Let me first wish all of you a Happy New Year. A Happy New Year.
Happy New Year, sir. Happy New Year.
I am happy to welcome and introduce to you Professor Dr. T Sivakumar, resource person of this evening. Our professor is a multifaceted personality. As such, informing about his qualification, experience, commitment to serve the society, especially to the old age, and his achievements in various fields in a short time is quite difficult. However, I shall briefly do it so that we understand how fortunate we are today to hear from a highly competent person on a topic of importance and relevance to us in our day-to-day life. Professor Dr. T Sivakumar, PTS for short, is born in the year 1977. After finishing his MBBS degree from Stanley Medical College, Chennai, in the year 2000, he had obtained his postgraduate degree in MD Psychiatry from NIMHANS in 2004. He has been working in NIMHANS from the year 2006 in various capacities, starting from assistant professor, then he became associate professor, and finally in 2017, he became a full-time professor. From 2021, he is heading the Geriatric Psychiatric Unit of NIMHANS. He holds several other positions and honors like Technical Advisor to Dementia India Alliance, VP of Banglaore Chapter of Alzheimer's and Related Disorders Society of India, Joint Secretary of Indian Association of Geriatric Mental Health, and many other positions in central and Karnataka state government-sponsored institutions. He has won several awards. He has also been responsible for NIMHANS getting Vayomanasa Shamman National Award under the category Best Institution for Aging-Related Research from Government of India. The outreach through the VMS platform is happening due to his active involvement and leadership. In fact, many hospitals in India do not have geriatrics department at all. In that scenario, Dr. PTS is successfully serving seniors through NIMHANS and is heading the department that is celebrating the 25 years of service to the society. He shows his commitment to serve the seniors. We are aware that mental issues come to seniors as an uninvited guest. So it is necessary that we need to know and practice the styles that would ensure healthy aging and living. Dr. PTS is a passionate trainer and healer serving in one of the prestigious institutions of our country. He has trained more than 100 doctors in psychiatry and 200 in other allied fields. He is responsible for introducing and training several super specialists known as DM in various psychiatry related sciences. He has also trained several other professionals like caregivers, nurses, etc. We are fortunate today to hear from such a widely experienced, highly articulate, and fully equipped professor on the topic lifestyle for healthy and successful aging. Yes, Dr. PTS sir, on my behalf and on behalf of all others in the meeting, thank you for sparing your time to educate us on an important topic. As you know, we are a set of seniors trying to understand the various medical issues concerning this population so that we become aware of them from expert resource persons like you. Our objective is to learn from you the best lifestyle we should adopt for a healthy and successful aging. The floor is now open to you, sir. Kindly go ahead. Normally, we request participants to raise their doubts if any after presentation is over. However, you may go about in your own method, sir. Thank you. Thanks, sir.
I think thank you very much, Mr. Jamunathan, for having a very kind introduction. I think it is also humbling to participate in this program, which is going on for 3 years now. And September 2020 we started, and it is continuously being held. And also on this occasion of Happy New Year 2024, I greet all of you a happy and healthy and prosperous New Year. And our team, which is anchoring and which is conducting this program. Now, Dr. Vijay Kumar Herbishetter is the main coordinator, one of my colleague. He is the faculty in the Geriatric Psychiatry Unit, and he is the main person who is kind of ensuring that this program is being held on a regular basis. And then we have made a kind of small committee also, and looking at how we can strengthen this initiative further and bring in new resource persons, new topics, and how we can make it more meaningful, and so that also we can also reach out to larger number of people. So this occasion, if you actually see the Vayomanasa Sanjeevani's objective is primarily promoting healthy aging. And we have started this initiative as a part of United Nations Decade of Healthy Aging, which is from 2021 to 2030. And globally, World Health Organization, as well as the other agencies related to United Nations and all the countries have recognized the importance of aging challenge and the challenges related to population aging, and decided that healthy aging should be a focus which is applicable for everybody. And the lots of efforts are being done to implement this initiative in a systematic manner. So as our initiative of VMS, Vayomanasa Sanjeevani, is also for healthy aging, we thought today we will I think this topic has been discussed earlier also, but this is something for the benefit of all the people, and for us to commit ourselves towards this cause. We will discuss briefly today about the concept of healthy aging and various topics related to healthy aging will be discussed in detail about each and aspect, like for example, like diet, lifestyle, physical activity, handling stress. Various things will be discussed as a separate topics over the course of next year. And we also are kind of observing and celebrating our 25th year of geriatric psychiatry services in this year. In September 2024, we'll be holding a program, a national conference, and also a 25th year celebrations. During that time, we'll also try to have a public engagement program wherein different activities we have been doing as part of VMS will get reflected in that public engagement program, so that there is a direct contact with many of you. We would like to see you if possible. If you are able to be in Bangalore and if you are able to attend this program in person, we would like to meet also. And a lot of our volunteers and a lot of our senior citizens who are active members and our committee members, they have been instrumental in enthusiastically participating and encouraging us for conducting this initiative. And some of the organizations like our Samadhana Center, Counseling Center, and Professor C.R. Chandrasekhar, and some of our NIMHANS administration and our partners, IPS Karnataka chapter, as well as people who are funding us with some support, like Icons and Life Sciences Limited. So I take this opportunity to acknowledge everyone and our team members who are coordinating these activities. There is a parallel Tamil program, Kannada program, which is also happening. And Mrs. Ratnaprabha is anchoring one of the Kannada programs, and my father, Mr. P. Tangaraju, he is anchoring Tamil programs. So I take this opportunity to thank all of them for ensuring that this Vayomanasa Sanjeevani is gaining from strength to strength and then being implemented in a manner in which it will benefit people. So today, I will discuss this concept of healthy aging. Can you see my screen?
Yeah. Yes, doctor. Everything is visible, doctor. Yes. Everything is paka.
So I think all of us know that we have been hearing this again and again, that population aging is something happening. So what do we call as population aging? Population aging is the proportion of elderly population. In our country, we call 60 years and above as older adults or elderly population. In some of the countries, developed countries or Western countries, 65 is the cutoff. Globally, for WHO, 60 is the cutoff. And if you look at, I request everybody to mute other people.
In fact, I have muted everyone, doctor. I don't know how she is able to.
Yeah, I think sometimes it may happen. I think if you are able to notice, please mute.
Yeah.
I think it can happen. No problem. No problem. So, why this is happening? Why this population aging is happening? Primarily because of increase in life expectancy. People are living longer, which is a very good thing. And there is also a decline in mortality rate. People are living longer because at birth, whatever reasons why people were dying, because most of the deaths were happening in the initial period of related to delivery, complications used to happen. Infant mortality rate used to be high. And then the later life also, some of the advancement in medical conditions has contributed to the decline in mortality rate. Parallel to this, with development and education, there is a decline in fertility rate. People who were having family size or 3 or 4 or 5 or 6 children in earlier in the now are having 1 or 2 children. So all these things are contributing to increase in the proportion of population of older adults, which is right now around 10 to 12%, which is projected to increase rapidly to 20% by 2050. So in numbers, in India is contributing to 15 crores as of now of elderly population, which is going to increase to 35 crores in 2050. To an extent, this is a rapid population aging, because in by another few decades, we will be actually crossing the proportion of children, because as of now, children and young adults are the prominent. India is still a young country, but by the next 2 decades, the older adult population will overtake the population of children less than 14 years. So that means we'll be seeing more elderly people. 1 in 5 will be elderly people. And another important issue for us to notice that whenever elderly population is more, there are also more women, because women have few years of additional life expectancy. So they live longer, and this contributes to the share of women being more is there whenever the elderly population is more. And this comes with certain social issues, and then their needs, which needs to be kept in mind, because women in our country, in the previous generations, literacy has been low, their work participation has been low, so they have not been financially independent. Most of the larger proportion compared to men. So there are additional challenges related to that. In India, there is also a large proportion of older adults live in rural population, wherein this kind of online programs don't get access to those kind of issues. We need to take care of the needs of rural population. As of now, it is around 60 to 50%, which is further going to kind of remain more than 50% over the next few decades. There will be some, if you look at the metros, if you look at the cities, there is some degree of urbanization is going to happen, but still for the next few decades also, larger proportion of elderly population is going to remain in rural areas. So we need to take that into consideration also. Now, when we come to 50 years, okay, when we say that aging is kind of person has become a senior citizen or an older adult. Now, how long one should look forward and plan? The reasonable life expectancy or average life expectancy is nearing 20 years. So in southern states like Tamil Nadu, Kerala and Karnataka, it is already crossed 19 to 20 years. In northern states, it is lesser. But with over time, this is something like at least 20 years and even more than that, we should actually start planning. So, which is a very, very important factor one should keep in mind. So, 20 years of life, which is a roller coaster kind of thing, where because a lot of challenges and uncertainties are there also. Because why we are concerned about it? Unlike the young children or the working adult population, in elderly, health becomes an important factor. Because many of the chronic health conditions, they are not something merely due to aging, but they are all common in older adults. With aging, certain conditions becomes more common. For example, Alzheimer's dementia. This happens more commonly in people above 65 years, in around 5 to 6%. If people are above 85, 90 years, almost 25 to 30% may have Alzheimer's disease. So merely because they are living longer, certain chronic health conditions like diabetes, hypertension, osteoarthritis, what we call as a knee joint pain, the pain in joints, other back pain, low backache, all those things can become more common. Cataract, these are all some of the health conditions which in many topics related to our VMS programs we would have discussed earlier also. So with aging, there is another issue that happens is people become dependent in terms of financial dependence, physical dependence, psychological dependence, because they are not earning livelihood on themselves and they need assistance in at least some of them. This is not a universal truth, because like there are still elderly people who are in 70s and 80s taking care of younger people who are independent and who are earning their livelihood, particularly in rural places. When you go, people do agricultural work, or as a head of household, they may be contributing and they may be productive. They may be earning and they may be managing everything by themselves. But larger proportion of older adults become dependent also. And so if we have to have the 20 years what we have gained in terms of life expectancy, what is the elderly period and the life what they're spending, it has to be a good quality of life. What we need to focus is about increase in healthy life expectancy. How many years in that additional, in that years after 60 years, we are able to live healthily. So that is the focus of healthy aging. So it is adding life to years as well as years to life. Both are important. So we need to live longer, but at the same time, that life should be, it should not be just simply survival in terms of years. That should be lively, and the good quality of life should be there. So that is the whole focus of healthy aging. And this is something applicable to everybody. It is not simply because somebody who is super healthy or who is very healthy people, only for them it doesn't apply. So what we call as healthy aging, the WHO has defined this as the process of developing and maintaining the functional ability that enables well-being in older age. The two important words what you need to notice is well-being. So the elderly, when we say healthy aging, the focus is on achieving well-being. So which has a good psychological component as well as physical health component. And the focus is also on functional ability. What is called as functional ability? The person is able to do activities what they want to do. And this functional ability is the most important thing. We are not talking about remaining disease free. Even if a person is having diabetes, hypertension, if they are functional, if they're able to do all their activities, if they're able to be productive, and that is going to lead to promoting the well-being. So when we say aging, there is some degree of decline in capacity. The brown line, what you see here, indicates the capacity. Capacity means both the physical capacity and mental capacity. So with aging, because of physiological changes as well as illness, you may see some decline in the capacity. How much distance you are able to walk without support, how much strength you have to do activities, how is your thinking capacity, how is your memory, all those things can change, can decrease over a period of time. This is not something that happens uniformly to everybody. There will be a person who is 70-year-old who is looking and performing like 45 or 50-year-old. There will be a person who is 50-year-old who is, because of his health issues, he will function equivalent to somebody who is more typical of 70 years. So when it comes to aging, age is just a number. So there is, you can't homogenize everybody. If somebody asks you to draw a aging person, what you usually see is in many pictorial depictions, somebody who's frail, who is elderly, who has a walking stick, who is kind of requiring assistance. That is what is being projected. But what we need to know is that there is a lot of variability in this. We know that a lot of people develop problems, but there is a lot of variability compared to children and adult. Elderly are a more heterogeneous group. So same age persons, there will be people who are bedridden. The same age person, somebody will be running a marathon. Like we have a faculty who 65, nearing 65-year-old, who has climbed many peaks, mountain peaks like Everest, and various peaks he has climbed. So he's fit enough than any of the younger 40-year-old or 30-year-old person. So age alone doesn't defines your capacity. But what we also need to know is that even if there is a capacity is declining, can we improve the functional ability as to what they can do? It is possible by providing appropriate environmental support. For example, somebody has a visual impairment. By providing support in terms of spectacles or undergoing cataract surgery, their vision can be improved. And then functioning can be improved. If somebody has a walking difficulty, if their mobility is restricted, if the environment is supportive, they can have a wheelchair, they can have an assistance, their functioning can still be improved. So like that, if by providing environmental support, functional ability can be improved. So we are focusing on this healthy aging is to how we can maintain this functional ability by providing appropriate supportive kind of services, as well as how we can preserve the capacity. We know it is declining, but how we can maintain and how we can be resilient, how we can improve, promote. So that is the goal of the Healthy Aging Initiative. Now, this picture demonstrates that healthy aging is something which is applicable to everybody. It is not something, some of you may think when we say healthy aging, we are talking about people who are running marathons, older adults who are super fit. No, we are talking about elderly, everybody. So there is 1/3 of elderly who are probably very good in terms of fitness, who is still not having much of chronic conditions. You might have heard, I have never taken any medicines. I have never visited doctors. I am doing all my work completely. So they are fortunate. They have also possibly have good genes. They have taken care of their life from younger age in a good manner. They have been fortunate enough to maintain their health like that. Healthy aging is applicable to them because the focus is on preventing chronic conditions so that they don't develop any other conditions, which is usually common in this age group. And we can promote well-being and promote capacity enhancing behaviors even in them. But the other 2/3 of individuals who are having problems, they may have chronic medical conditions like diabetes, hypertension, or ischemic heart disease. They may be taking 4 or 5 medications. But even for them, we can provide appropriate health services. They may require, some of them may require further interventions to promote and prevent disabilities. And for them also it is important. And people in the other end of the spectrum, where they already have developed disability, they have developed stroke, or they have developed, say, dementia, where they are requiring assistance. They are not independent completely. Even for them, healthy aging is possible. At their level, how you can promote well-being. So can a person with dementia remain, say, somebody who is forgetful, somebody who cannot remember what is happening on a day-to-day basis? Are we talking of well-being in them? Is it something like an oxymoron? What we say, it doesn't go with people who are having dementia. No, definitely no. Because there is a theme called living well with dementia. Even somebody has dementia, even for them, well-being can be promoted. By giving appropriate supportive environment, you can enhance their well-being. And the aim is there to provide rehabilitation services, to provide appropriate environment support, and so that ensure dignity, because ultimately we want well-being and dignity, so that these persons who have disability also, you can promote from whatever level they are, their functional ability can be improved to the next level. They may not become super fit to run a marathon or to climb a mountain peak like super fit individuals. But from being bedridden, can they be made mobile with wheelchair support? Can they be made mobile with the help of somebody assisting them? Can a old age home or a residential care center give them that freedom for them to roam around without having a risk of losing themselves? So even that is something healthy aging. So this is the public health framework of healthy aging. Earlier, WHO used to talk about successful aging. Successful aging signified that only it applied to narrow spectrum of people who are super fit or who are healthy. And we have reframed it now so that it is applicable to the whole spectrum of elderly population and nobody is left out and everybody can benefit with this initiative.
Doctor, before you proceed further,
yes,
there is one small question in the question box, in the box. It
Okay.
appears to be very interesting, Doctor.
Okay.
Is there any scale to find the psychological and mental aging apart from psychological aging?
Yes,
Is
yes,
there any scale?
yes. So when we call say mental age, one of the connotations we talk about it is IQ assessment. Okay. In developmental disabilities, mental age is calculated by doing certain tests as well as eliciting the developmental milestones. We talk in children. Even in adults, older adults and senior citizens also, mental age is calculated if it is a developmental disability. Psychological and mental aging, the impact of those things, whether it is in terms of how their mood operates, how their anxiety levels are there, how is their stress levels are there, how is the their resilience, wisdom, various things. There are specific scales are there. With respect to cognitive function, there are specific assessments are there. So there are some global scales which talks about quality of life, well-being, those instruments which gives a kind of a holistic picture, but there are individual scales which talks of different dimensions, which is one of the domain of psychological and mental aging. Okay, so
Thank you.
these are there are tools, there are standard tools.
Yes,
which
that
we
helps.
use for assessing those things. Okay, so did that answer my question? The question?
Yeah. It answers, but only thing is where it is available, etc., etc. That will be a larger one. We will
Yes.
try to address it in some other seminar.
So one way is that self-assessment is also applicable in terms of some of the self-report scales. Okay, but many times these are used as part of research assessments or as part of intervention. Sometimes in the clinic we assess. There is something called as a comprehensive geriatric assessment, which takes into multiple domains. So we will, because that takes into mobility, dependence, how their functioning is there. Various things are assessed with some standards questions. Okay. Now, we will briefly discuss about what are the various factors that influence healthy aging. Because when we talk of healthy aging, it doesn't start at 60. So many of the factors for healthy aging starts even before we are born. So because genetic factors, there are certain families where you might have noticed people may live longer. And that is basically because of some of the genes which is transferred, as well as the early development and early environmental exposure that has happened to them. If they had a good nutrition, if somebody in the family were educated, they might have got good cognitive stimulation, good education in childhood. All those things also would have contributed. And personality. The personality is something which develops as over a period of time from birth. From the early development, it gets developed further. By adulthood, your personality is more or less kind of become well established. And thus also plays a crucial role in how you approach your life and how you take care of yourself through your life course, and then how you spend your elderly age group or aging also. So these factors, many of them are not modifiable in the initial period of time, because these things already would have happened. But what is more important is, it is not something like which is fixed. Like if it is the genes are bad, or if it is you already have some kind of a personality issues, it doesn't mean you can't help yourself. There are several modifiable factors which influence healthy aging, which at any time when you start working on it can help you. Because you are 70 years now, you still have a scope for change. You are 80 years, you still have a scope for change. So that are most important factors what we need to notice. One is physical health. When it comes to physical health, the non-communicable diseases, or what we call as NCDs, are some of the major factors. Diabetes, hypertension, cholesterol issues, stroke, cardiac conditions. These are something. The second is sensory impairment, whether it's a hearing impairment, visual impairment, and mobility. These are some of the most important aspects of physical health. All the systems, whether it is a urinary issues or skin or any issues, are important, because when you feel healthy, your health whole as a whole has to be better. So you need to pay attention to all the systems of health. When it comes to mental health, the two important things that happens is your mood, that is depression and cognitive impairment. So memory and how you feel positive about it. And because a lot of people may not have a depression which is significant enough for you to seek a psychiatric help. But in a recent national survey, national study that is done, what is called as a longitudinal aging study of India, almost 1/3 of elderly, nearly 30%, actually had significant depressive symptoms. In the last 1 week, if you ask them as to how happy or how was their mood, 1/3 of them reported they were not feeling well. So this could be something which is not simply an illness. This is something where, because of various factors, because of the life conditions, how is the support system, what are the challenges. So when we talk of depression, we are not talking, when we talk of mental health, we are not talking about only the tip of the iceberg who are having mental illnesses. Everybody has mental health issues, or whether how you respond to stress, how you react to a particular situation, your mental health gets affected. And cognitive impairment at a mild level also can have problems. So one needs to be taking care of that in a positive manner as much as possible. The other crucial issues are family support, because we, particularly in Indian culture, I think globally also it's applicable, but in our culture, there is a lot of importance given to the role of family. And our success, or how healthy and how our well-being is there, is determined not only by ourselves, it is also by how our family is doing. And as head of the family, many of the older adults, they feel responsible for how their other family members, whether it's a spouse or children, even grandchildren, and how things are happening. So both in terms of their well-being, interpersonal relationships, how it is operating, all those things are crucial determining factors. Other than family, relationship with friends, neighbors, and other support services, what we call as a government support or organization support, as a social support, that is also responsible. Financial support, income security is another major concern for our health, our healthy aging. Because many of the things what I talk about, maintaining your health is not possible if you don't have a good amount of resources. And whether it's about nutrition or taking care of your chronic health conditions, either you should be having resources, or the services of government should be of that nature where the public health system takes care of all the needs. So that is something very challenging in our context, but still, I think some of the things are available. We'll talk about it. So both basic needs, healthcare, as well as long-term care is important. For that, financial support is important. Lifestyle, we talked about lifestyle already. Diet, physical activity, substance use like alcohol or smoking, how sleeping pills, taking sleeping pills, all these things are have adverse impact on healthy aging. And having hobbies and useful and active engagement, whether it is spiritual activity or cognitive activity or some sports, having a meaningful purpose, volunteering kind of engagement, some social activities, all those things will be helpful. So having a purpose, a meaning in life and purpose in life, whether it is work or volunteering or responsibilities. This is something like every time other family members may not give you this opportunity. So you will have to plan it out yourself as to how you are remaining useful, what you can do, accounting for your health limitations, and what are the resources, what is available. So anything because one need not look at the best possible kind of support or best possible opportunity. Whatever is possible within the resources in your context, that can be done. Now, okay. So when it comes to all these things, it is not something which is always doable only by individual themselves. There is a need for collective action at the level of individual as well as the family, society, and the government. So that is why United Nations Decade of Healthy Aging is being observed, where multi-stakeholder participation will be there, and everybody has responsibilities towards this. So the four main action areas, what the United Nations experts have come up with as something which is very, very important to promote healthy aging. I will briefly address that. So this is something which our VMS programs also try to address these aspects on individual topics related to this in various programs. But to give you an overview, these are the four action areas. One is combating ageism, and second is promoting age-friendly environments, and third is integrated care, having an integrated person-centered care, and promoting long-term care and providing access to those who require long-term care. I will briefly talk about each of these four topics. So what we call as ageism. Ageism is how we think and feel and act towards age. This is how we feel ourselves as to how we think and feel, how the family members and society thinks about elderly persons. So it is from multiple perspectives. So ageism by self, family, as well as others. Just to give an example, when we think of hearing impairment, so there is almost 1/3 of elderly population have hearing impairment, and only less than 5% or 3% actually use hearing aid. So why is it so? If you ask people, one is that, okay, I have already had aged, I don't need to do anything active. There's no need for me to correct this. Okay, so the family members, sometimes the hearing aids can be expensive or they have to take and then they have to go for evaluation. What is the big deal? If you don't hear everything, if there is some noise, it's okay. Because he's aged, he doesn't need to actually perceive all the sensations in an optimal manner. So people don't even go for checking. And when the person complains also, the family members don't take. Sometimes doctors also will say that, okay, it is okay. It is not something that it's a minor problem. You can ignore it. So even that extent it can happen. So when it comes to something like a joint pain, nowadays people can undergo surgeries and do joint replacement surgery. And actually their pain can be resolved. Now, when it comes to, okay, an elderly person, the person may feel, I'm already 70-year-old. Why should I spend lakhs of rupees to do this? Even if the person has resources, he wants to save the money for grandchildren. He wants to save the money for the house. Not looking at his own quality of life as to how this is going to make a change for him or her. So the same attitude issues with respect to family members and society also you can think of. Whether government thinks this as a priority issue and addresses for elderly people. Are we making it easily available for in public health system? So that's the attitude of the government also. We need to see that it is not just a charity, it is a right of elderly to get the best of the treatment, best of the supportive whatever services available, so that they are having a good chance of maintaining a dignity and well-being equivalent to any other person's age group. They are not something living on charity. It is their right. So whether they should be able to afford themselves, or for people who cannot afford, it is the responsibility of the society and the government to provide such services. Even simple things like dental care, it is being seen as a cosmetic things. So how much of our elderly people have access to, say, if their teeth are have to be replaced? Is it easy for us? It's quite expensive. And how much of services are available in rural places in a public health system? If you see that, it is not seen as a very easy thing for people to get it done. So that acts as a direct effect on what kind of food they can have, how is the nutrition being maintained. If you look at Indian population, we have in older adult population, underweight is much more common than obesity. People lose age, they become frail, they lose weight. So underage, having low weight is one of the important things and their immunity gets affected because of that. They get infections, they have falls. All those things are complications. To protect them, they need a good dentures. So that is an important essential thing. Are we able to provide for people who cannot afford? This is the question we need to ask. And environmental support. How many of us have actually adapted our environment? I asked this question myself. It is not, we don't pay attention to this as much what we should do. And all of us should look into it and see as to how we can actually implement it, so that the safety is taken in a serious manner. And if your children are not getting done, or you should ask for it and you should insist and get it done. So that is something like, nothing happens just like that. So you have to give priority for these things. And another aspect is about, when it calls ageism, it is also about adaptation by self and accepting this role transition. Even that is important. So sometimes the other extreme also is a problem. So for us, when we say you should not be thinking negative about aging, but at the same time, we need to have a realistic understanding as to how much risk we can take and how much, for example, in COVID, when people tell, okay, elderly needs to be wearing mask and they need to be protected. It is not to kind of put you down. It is to protect you, because the people who get infections, younger people, they are able to survive without much of a problem, majority of them. But elderly people, if they get COVID, the mortality rates are higher. So when it comes to adaptation and acceptance, that with aging, what is our strengths, what is our weaknesses? So ageism doesn't mean that you take risk and you take be reckless. We need to be balanced and we need to accept the role transition. Both are important. Now, ageism is something universally prevalent and it is harmful, but it can be combated. So initiatives like our Vayomanasa Sanjeevani, this is one of the important activities what we do with outreach with senior citizens as well as other younger people, and through educational activities, even law, the Maintenance Act, which is there, the Maintenance and Welfare of Parents and Senior Citizens Act is a very important act which needs to be promoted in terms of awareness. So I think I should appreciate my father took a lot of initiatives, and then he conducted a program recently in Dharmaburi district where the district collector organized a meeting where this topic was discussed with all the officials concerned. So it's very, very important for us to take such initiatives. Even as a senior citizen, you can do such things in your place. When it comes to age-friendly environment, we already talked about adaptations in both at home as well as outdoor spaces and buildings. Being disabled-friendly and age-friendly is very important. Transportation. Again, transportation, say, we are not living in a what we call as a high economically developed country like Scandinavian country where everything is taken care of by government. A lot of things we still have to go a long way to make it easy for people who have difficulty in affording, difficulty in access. But you need to adapt with whatever resources available. For example, transportation. You want to actually visit places. You need to see as to how you can enable it. For example, if you are living in housing is in second floor or third floor, there is no lift. You see as to whether is it possible for you to relocate. You need to convince your family members, and you need to see whether if you relocate to ground floor, because children may not feel that need. Sometimes they may think that, okay, living in that higher floor, rent is lesser, so or it is convenient for them. But your needs, you need to kind of discuss and negotiate and see as to how you can do it. Being part of a group of senior citizen club, socially inclusive participation, all those things are very important. So all of you participating in this kind of forum itself is an important initiative, what you are doing. And some of the things is not just respected, not to only for senior citizens, the other people, stakeholders, family members and younger people have to respect and socially include them. And government and civic agencies and health services, everybody has responsibilities for it. So we will discuss these topics in detail in different topics. Now, when it comes to healthcare, I think there is an important message what I would like to discuss here. When it comes to healthcare, all of us think of specialist, super specialist healthcare. But the most important healthcare is a primary health care, or what is called as a family physician. So senior citizens should have one family physician who knows well about you, whether it is a common cold or diabetes or hypertension. You should be able to see one regular doctor, whether it's MBBS or Ayurveda, whichever specialty, whichever profession you are seeking. You need to have a trusted health advisor, health physician who can actually guide you and then take care of your health in a proper manner. Specialist role comes secondary, and integrating all these things is important. There is a need for assisting services from nurses, physiotherapists, social work, psychology, occupational therapy. All those things are important. So for that, and even Ayush is very important. And services needs to be available at home. For people who can afford, there are organizations willing to provide this kind of services. And in some of the government have taken actually initiatives for schemes where people are visiting at home. Now, Tamil Nadu government has done, Karnataka government has done. So there are schemes now coming that doctors and health professionals have to go at home. So this is again another important aspect what we need to keep in mind. So integrated healthcare has to be integrated, person-centered. It should not be compartmentalized. And long-term care, when it comes to long-term care, providing access to those who need it. So almost say 1/3 of people have some or other disability. In the longitudinal aging study of India, nearly 25% were not able to do their basic activity as of daily living. So they need support either at home or in daycare centers or respite care services or residential care services. The focus is on well-being and quality of life and ensuring dignity. And many of these services are restricted to cities, and even in there, they're not available easily in free of cost or at a limited cost. So this is something like one has to develop. There is a responsibility for the government, responsibility for organizations, and then you as senior citizens have to advocate and demand the services also, because you are also equal stakeholders where you need to advocate and then you give a voice. Then only things will come. And when you have all these services, again, it should be of quality of something is very important, and it should be affordable. So that's where to maintain standards, something like NABH, which regulates hospitals, there is a need for standards in ensuring these services, good quality services. The Maintenance Act actually has a provision for those kind of things. In the amendment which is proposed, this kind of guidelines are going to come and regulations are going to come. And affordability, we need to think of insurance systems. Now, Ayushman Bharat insurance is there, private insurances are there. I don't know how many elderly actually have insurances. People who are government employed, pensioners have some insurance. But many of the senior citizens may not have insurance. So nowadays, you need to enter even before, I think up to 65 years, there is entry is possible. So we need to start thinking about and advocating about getting insurance, medical insurance, and even long-term care insurance may come up in the next few decades. Already in Western countries, developed countries, they are there. Now, how these things have to be implemented? One of the most important thing is health literacy. You all have to be empowered to know what is good, you need to be aware of various things. So for that, health literacy, the VMS program is all about health literacy. So that we discuss these topics, then you take decision, then you explore more and get more information. And we also are trying to see as to how we can promote volunteering opportunities, both for younger people as well as senior citizens, and providing peer support and volunteering support. Senior citizens can support them, other senior citizens. So there's a program, our team is actually working on it. It's called as Happy Healthy Aging Program through peer and younger volunteers. Some of my students are actually researching on this topic to develop training modules for this. And here, as I talked about, there is a role for older adults themselves, family and society, as well as non-governmental organization and academic institutions like NIMHANS, as well as health services, and the government, which is the most important entity where policy, legal provisions and programs and schemes, these are there. Through the VMS program this next year, we will be covering various topics related to law, related to various senior citizen programs, and what are the policy, senior citizen policy. All these things will be topics what we'll be discussing again and again. So I'll stop here. Thank you very much. we can discuss few questions if there is any clarifications and additions can be done.
Yes, doctor. Thank you, doctor. That was an excellent, presentation covering the whole gamut of what is needed by us, what is needed by the senior citizens. Thank you, doctor. Mr. Ramnath has raised his hand. I will now request him to unmute and ask the question.
Hello, sir. Wish you all happy and prosperous New Year.
Thank you.
I am having two questions, sir. One, the birth rates of birth deaths of younger one and the old age periods are increasing, not decreasing. Another thing, due to the old age homes and discarded by some of the sons and daughters, the old parents are approaching old age homes. That is increasing day by day in India. So what are the reasons? You are saying that everything is carried by the government and other associations. What is the reason? Again, the percentage is increasing last 10 years. The last 10 years, there were only 23, 24 old age homes previously in 2001 or so. Now it is increased to 80 and 90 old homes in every part of India.
Yes.
Please, thank you.
Yes. I think you have rightly said the services are increasing. One of the main reasons is the number of elderly people are increasing. Okay,
Yes.
so we are living longer. We spend at least some proportion in with some disability. So there is a requirement of support services. So we should not see old age home as a negative thing completely. Because if the care needs cannot be met at home, you need a dignified life, a supportive environment.
Excuse me, but the caring is very much done at homes. Nowadays, it is possible in the summer thing. The caring of elders are good in old age homes. Some of the old age homes.
Yes. That's what I'm saying. Say there are countries which are spending a lot of resources where the government is spending millions of dollars and much more resources are given for old age care. Even they have there is a commission in Australia which looked at the practices in old age homes. There is a report which is available in the internet. If you search, there are so many. It's called as Royal Commission report, and so many practices of elder abuse are happening there also. So whenever there is a service is there, if there is no monitoring, if there is no standards, if there is no standard operating procedures, there's no regulatory agencies, it will lead to a lot of abuse and a lot of malpractices. So the government needs to regulate these things. There is no doubt about it. So if as of now, there are mechanisms. There are mechanisms where you can report. The Maintenance Act is something. Legal Services Authority, the police complaint you have to give, or the revenue administration you have to give. Helpline, elders helpline is there, you can complain. But it needs to be made more stringent. More regulation has to be there. So that people are not taken, treated in a bad manner. But services are required. If we say that, okay, old age homes should not increase, and if you ask for the proportion of our population, whether old age homes are adequate, definitely no. Because if you see, still there are lots of people who have not able to prepare food themselves, not able to take care of themselves because of want of guidance and because of want of proper placement, and they cannot afford old age home. They die early, and then they die in a manner which is not dignified. So this is something every day, only limited people who are able to get access to these services, particularly for people with a lower income and who cannot afford. And people who are rich, for them also, whether appropriate, good quality services are available, still there is a lot of scope for improvement. So when you have more competition, more awareness, more services are there, you can choose. You can choose what you want. So it is inevitable. What Mr. Ramnath has highlighted, it is inevitable because there is a requirement, but how you can minimize in terms of not everybody should be dumped in old age home. People who home support can be given, support as
Hello, sir.
Sorry.
Birth deaths are increasing, sir. There is no normal delivery nowadays. 80-20% is there. 20% are normal delivery and 80% are this thing.
No, I didn't understand your question. You are saying
No,
birth,
no,
The cesarean. He is mentioning about cesarean.
birth rate. Birth rate is,
but
see,
that
birth
means
rate is-
about delivery period. They have to delivery. There is no normal delivery.
that's a different issue. That is a different issue. But delivery is number of, say, what we are looking at is that how many children each of them are having. If you look at that, the family size, birth rate is coming down. Okay, with the fertility control, the family size. Earlier, people used to have 4 or 5 children. Now it is only 1 or 2.
Nowadays it's okay. Not okay. Thank you very much, sir.
Now, Mr. Tangaraju, father has raised his.
Thank you. Thank you, Mr. Jambunathan. Only one suggestion. As he mentioned about Dharmapuri district meeting of senior citizen about the district administration, the association has to approach the district collector or deputy commissioner, as the case may be, and ask them to conduct such meetings with the line departments to create awareness among the officers first. The staff and officers are not looking properly the Maintenance Act as we expect. That's why our district collector, Mrs. K. Santi, is very kind enough, and the district social welfare officer also is very kind enough to conduct, because we are insisting them for the past 4 or 5 years. Now only they have accepted, and it is very, very useful. Most of the people are department participated, and we are following it to publish some book to entire officers connected with the act. Thank you very much.
Thank you, sir. That's a very good initiative. I think this initiative needs to be followed up at all levels in various districts. Now I think Mr. Bachai Gowda wants to talk, sir, doctor.
Yes. Please go ahead.
Please go ahead, doctor. Bachai Gowda, sir.
You can unmute.
Please unmute yourself, sir. Bachai Gowda, sir.
Sir, you have to unmute, sir. Mr. Bachai Gowda, sir.
Yeah, he is not able to unmute himself.
I think that is.
Yeah, he is not able to unmute.
I think Nisha, can you?
No, sir. See, that's the problem. And now he has unmuted, sir.
Yeah. Good afternoon, doctor. After a long time, happy to see you.
Yes.
After nearly 2 years, am I right? You were here in Lanka for our general body meeting held at BBMP building.
Yes,
Now,
yes.
last year we had one international hotel. This year also we are planning at Clarion Hotel. I may request you to join. Number one. Number two, Maintenance Act and rules, when it is going to be implemented in Karnataka, sir?
So, Maintenance Act came in 2007. Maintenance and Welfare of Parents and Senior Citizen Act. It is already under implementation.
No, rules and regulations, it is on the way, you were telling.
No. Rules also is under implementation. There is an amendment which is pending. There is an amendment. This amendment.
Secondly, amendments. Okay.
This is 2019 amendment.
Concessions
Still
in
not
railways. Secondly, concessions in railways for seniors, it is not restored. How we should move forward? Number one. In Rajasthan, in BMTC and local bus services, there is up to 50% discount is there. We thought of moving with our transport minister also. So in that regard, one is what you are telling, other district, some action taken by collector and other thing. That some correspondence, if it is given to us, similarly, we can move here also.
I think already women is free. And
that we are aware. We are asking instead of 25% discount up to 50%. Yes. I heard in Rajasthan and other states up to 50% discount is there. Number one. Number two, railways, it is not restored after COVID.
I think this is something which has to be taken up at the government level and discussed. One of the things what you as senior citizens you can also do is to advocate through using sources like RTI, using parliamentary questions with the people in MLAs and MPs. You need to ask questions, and you need to, as an association, you can actually represent. And because all the senior citizen associations know, this can be an advocacy. This is, I think everybody, all segments of society will keep asking for their needs. I
Correct,
think
correct.
you are right. And what
Right.
government can give, it depends on how much people are asking and how much they are having economic resource and what is the
Okay.
priority. Okay. So when COVID came, certain priority was there, some benefits were taken out. So whether that can be restored, for example, pension, even indexing the pension to inflation, some countries have done it. I think that is something like that kind of change, like government pensioners get DA, but old age pension, which is given for destitutes, that doesn't get changed with inflation.
Yeah, yeah. It is fixed. EPF.
Yeah, correct. So these are
Lot of
things like organizations, non-governmental organizations have to keep advocating for it. There are people who are asking. So, for example, we are giving 1,000 rupees. Is it enough for people to sustain themselves? So, how can, because government cannot give everything. They also have
correct,
economic
correct.
limitations.
Limitation.
But things don't change in a day. Advocacy and keeping demand is what we can do.
Oh,
I mean, as
very
part of senior citizens campaigning, we need to continuously campaign for that. We
Yes.
need to say, yeah, this is, and Doctor, only one, one point I may like to add is that, see, all, as you have correctly mentioned, all senior citizens are not having the same kind of health. I agree. But can you just still, further classify senior citizens into 2 or 3 kinds of subclasses? Say people up to 70, between 70 and 80, and above 80. Because the more the old the person becomes, the physical disabilities and other disabilities the person faces is more. Will that in any way help, doctor?
So I showed you a graph. I can again show you that also, because it is not just dependent on age. I gave you some example also.
Yes, doctor, I agree. But
it is not merely because of age. It is about the functional ability. So this graph, if you see, we divide as to 1/3 and in 3 groups. So there may be a person who is 80-year-old who may be in the first group. Okay, in high and stable capacity. There may be a person in 60-year-old who may be in the last group where he is dependent. So age is one criteria, but we should not just go by age. But generally, when it comes to the chance of them having problems is more with increasing age. So somebody who is 80-year-old or 85 or 90-year-old, nowadays you will have more centenarians also, people who are above 90 and above 100. They are likely to have more frailty, more disability, more challenges. They need more support. That's why the pension is given more, or tax benefits are given more, those kind of things. But what we wanted to emphasize is compared to younger people, elderly are more heterogeneous. Just age alone will not determine.
exactly. Yeah, that's what I was. That was my point. And one more request is that this comprehensive geriatric assessment.
Yes.
Can NIMHANS, stipulate something, some kind of a yardstick, so that even smaller hospitals, smaller primary health centers or something like that, they can also do this and help the senior citizen, doctor.
Correct. Correct. As I said, see, this is something like the speciality of caring for elderly is something only happening. We have very few geriatricians. In Tamil Nadu, there's one Dr. Nadarajan, who is very famous for geriatrician.
Dr. VMS.
Yes. So like that, but now the government has done training opportunities for the training geriatricians. So one of the fundamental things in geriatrician is to look at a holistic manner. And that's where the comprehensive geriatric assessment comes. So which looks into not one system. Like if you go to one specialist, like diabetes endocrinologist, they focus on only diabetes. So they may refer you to, for hypertension, they may refer you to another doctor. That kind of specialization has happened now. So not all doctors are like that. But too much of specialization is not required for a regular chronic care. You may have one second opinion, but you need to have a family physician who is good to look at comprehensively, whether they use a comprehensive geriatric assessment instrument or by practice, they can do it.
Yes,
It depends on, for example, institutions like AIMS has a separate geriatric medicine wing. If you go there, they will do it as a part of routine. If you come to NIMHANS, we are able to do certain things as a routine. But for individual clinics, there are geriatricians who are doing very well. this kind of comprehensive assessments. We are training doctors whenever they see elderly, they should see comprehensively and do a comprehensive geriatric assessment. So when you choose your doctors, you need to see as to who is evaluating not only one organ or one this thing, who is kind of the basic physician or what we call as a primary care physician. You should have one physician who should be able to look at you as a holistically, and you should trust that person.
Yes, that's the whole thing. Trust should be there between both of them, between the doctor and the.
And over and above that, specialist and if they are good physicians, they will refer you to appropriate specialists when it is required.
Exactly.
Dr. Mahesh is there now here. I think he also practices geriatric medicine. So there are people who are specialized and then who does this kind of work.
Yes, doctor. That helps, doctor. Thank you, doctor. I think the time is also up, doctor.
Yes.
I know I should not trouble you too much. Is there any quick question anybody wants to ask?
Yeah, in Dharmapuri District Medical College Hospital, there is 20 bed provided for a geriatric department. The Dean, ARM, representing Dean, has spoken to our meeting. We have to utilize, she was telling, in all medical colleges, there is a provision. Thank you.
Thank you. That helps, sir. That's a very good information. I think most of the state government hospitals, and even in Karnataka, I think that kind of a specialization, that kind of a reservation is available. Doctor.
Yes.
For senior citizen ward is there, something like that is there.
It is emerging, and I think when you demand, also know when you ask, okay, whether this hospital has geriatrician, you ask, then they'll start employing more geriatricians.
Exactly.
You just do. I think this is an important need where somebody who can look at holistically, not just only one organ or one disease.
Yes, that's we have been doing that regularly. So now because time is also up, I'm requesting you just 2 minutes time, doctor, to give my final thing. Thank you, Professor PTS, for your lucid presentation on the topic lifestyle for healthy and successful aging. On our part, we pray God to shower on you and your family and your team all that are the best in life. May God give you strength to carry on with your service to your chosen field and achieve more laurels in your path of service to society. And doctor, only one small question I like to ask. See, there are so many other specializations available to you. As a person, as I know you, you would have shined in any field that you have taken. But you have chosen to come to this geriatrics department. Is there, what was the motivation for that, doctor?
Yeah, I think this is one of the emerging fields as of now in our this thing. It also has to do with our interest and opportunity. Both played a role because my teachers, in this occasion, I also like to thank and recollect my teachers, Dr. Matthew Varghese and Dr. Srikala Bharat, who are the founders, and we are now celebrating 25 years of geriatric services. So I worked with them as during my training. So that was something like which happened to me, and that gave me an opportunity to develop interest in this field and continue in the same field. Even though I could have shifted to some other topics, some other specialty if there was opportunity, but because of the opportunity that was available and inspiration that was available from my teachers and mentoring and support what is available, I have continued, and I'm happy about it. I'm happy to be amongst you, and because future is geriatrics.
Thanks, sir. We are very happy about it. In fact, we are happy that we have got a good person who can be.
I can see Mr. Nagaraj Rao also.
And who will be able to support us for all our needs. There is a person who is available who will support us. We are thankful to you for that.
So we are the growing population. So we will have a better lobby after 20 years.
But see, by that time you will be also quite old.
Yes.
Thank you, doctor. So,
thank you.
Thank you so much, sir.
As far as the
Thank you so much, sir.
Yeah.
Thank you very much.
Thank you very much.
Thank you very much. Very nice.
Thank you very much.
I think
all happy New Year.
periodical topics like this that will enlighten people, even the old, even and the younger one also. So they have to see that there is other page for this also like that. They should not be in the one look. That is very great, very great. Yes, it is very
Okay.
nice.
So
Yeah.
Thank you, Dr. Sir. Thank you so much.
Thank you, one and all. Thank you, one and all.
Thank you. Thank you
to the
very
team.
much.
Thanks
Thank you
to the
very
team and Mr.
Sir,
Jamnathan for anchoring
Very
this.
good
Thank you, sir.
representation, sir.
Before
Thank you very much, sir.